Namaste, namaste. So how do we protect the kids? How do we protect the kids? Because I think initially we all were thinking there was this thought out there that the kids weren't affected by COVID-19. And now we're getting these reports from New York that we don't know. We have kids that have this inflammatory response going on in their body, where their arteries and the heart, and it's similar to a disease called Kawasaki's disease, and some of the leading authorities are beginning to think, that this might be related to COVID-19. More to be revealed on that. I'm sure next week we'll have more information to tell you about that. But in the meantime, we have to protect the kids. So how do we protect the kids? We put masks on the kids. We put masks on the kids and help the kids practice social distancing. Because here's the thing, the child that the children that are asymptomatic and don't have any symptoms, we don't know which kid is asymptomatic. It has the COVID-19, but they don't have any symptoms. So that child can pass it to grandma, mom, dad, aunt, uncle, and we don't know. We really don't know. We're figuring a lot of these things out, but we do know that kids can contract the virus. So how do you protect the kids, and how do you protect yourself, the family? The kids need to have a mask. The kids need to practice social distancing. Because if what looks like to be true, if what looks like New York with this thing with the kids is true, then we're in for another battle with the kids. And how do we go about navigating through that, and so that the kids don't have to go through a horrible thing, that this horrible, drastic lives being taken and people being very sick. And that's the last thing that we want for our kids, is for that to happen. So, you know, the basics, we're back to the basics on that. Your kids need to be on multivitamins. We used to all take multivitamins. They need to have the mask. They need to practice social distancing, and you need to really talk to your kids. So they're smart. These kids are smart these days. And so, so with that, I'm going to close. I'm going to pray for a healthier America, and we'll be back next week with more information. Thank you.